Hello friends, my name is Dr. Ghaffar Ali. Today I am about to talk about KIMS telehealth for managing ENT infections and some review about COVID-19. First let me give a small talk about COVID-19. After that I will tell about common ENT infections whose symptoms somewhat similar to COVID and how to manage them. Okay, as you know, in KIMS we are having telehealth services where you can log on to us through the online. You can talk to us video, you can even share the pictures, and I can see the pictures and I can talk to you people, and all the doctor stream over here in the KIMS we can give you a better treatment and without affecting your health or without even having a doubt about the spreading the disease. So, as you know, in the Qatar now, most of the malls and the private clinics they're allowing only if your Aithraz app is green. If you're having any other colors, you're not allowed. So the other color people, what to do for them? The answer is KIMS telehealth services. Also, there are some people who have a doubt about coming to the private clinics or going to any other place, but still they want to have some treatment about some of their common problems. You can contact us through telehealth services. And even in your house there are elder people and you don't want them to get exposed and they're having some small problem, for them also telehealth is the best answer. Coming back to corona is just a small virus. It is a nucleic acid wrapped up in lipoprotein. Why the name corona? Because its outer spike proteins in the electron microscope, when we see, they look like a crown. In the Latin, corona means crown. Okay, so outside the body, the corona is actually a non-living being like any other viruses. They need host cells to infect. So actually we know about common human coronavirus from generations long. They just cause mild URTI infections. Lot of patients used to come to me just with the cold, and with the small treatment they'll go. But occasionally the animal coronavirus, whose natural reservoir is generally a bat, they jump into human beings through intermediate hosts. See what has happened in early 2000s. SARS infection has happened. It has jumped through civet. In Saudi Arabia through camel. We had seen MERS disease, Middle East respiratory syndrome, and now mostly because of the pangolin, this SARS. Why the pangolin? Pangolin is one of the most trafficked wild animal, and it is most trafficked because of its scales. It has got a lot of medicinal value and other things. So before going to COVID proper, you should know that there can be asymptomatic COVID patients. Even if you do the test, they may be test positive, they don't have any symptoms. Then there can be mild, they are having only mild URTI or GI symptoms. Moderate means they will have pneumonia but they don't require oxygen. Severe means pneumonia, they require oxygen. Critical means their life is in danger. So let us talk about a respiratory tract. The tract from which breathing takes place is a respiratory tract, from nose up to the lungs. Roughly, I want you to remember that from nose up to the larynx it is called upper respiratory tract. From larynx up to the lungs it is called lower respiratory tract. This respiratory tract, inside it is lined by the respiratory epithelium. What is that? It is a pseudo-stratified columnar ciliated epithelium. It means to say that there is a lining epithelium inside our nose up to the larynx, and over that we every day we produce constantly mucus. Only in the nose 1 to 1.5 liters of the mucus we produce, and this mucus, under the mucus there are cilia and they beat towards the pharynx. from the nose every day 1 to 1.5 liters of this mucus secretions, it is going towards the pharynx. Similarly, even in the lungs, it is going from the lungs up to towards the pharynx. Always it is kept because of the secretion of the mucus. In the nose, mucus secreting cells are goblet cells. In the lungs, in the epithelium, the type 2 are surfactant secreting cells. Okay, so what happens? See, those whose this ciliary function is very good, means in the nose or in the lungs, generally they will have a mild disease. And the old people or the people with so many other diseases, so many other problems, if their ciliary function is damaged, they are the one, they are going to have lot of damage even with the COVID or without COVID. And smoking is also one of the risk factor for damaging this mucus blanket or mucociliary mechanism, where the fluids constantly we are clearing it out from our airway tract. Okay, so now let us talk about how this coronavirus enters into our body. The main focus of entry is through the nose. It can also go from either eyes or mucous membranes of the mouth. Remember, it is like a T of our face, both the eyes, nose and throat, the T shape focus of entry. Some people, they tell that even from the GI tract lot of coronavirus are excreted, but still again the entry is mainly through this T. What will happen once coronavirus enters into our nose? It will seep through the mucous membrane up to the epithelial cells. In the epithelial cells, in the respiratory epithelium, there are some receptors called ACE2 receptors, angiotensin converting enzyme 2 receptors. These receptors, they can also be found in respiratory tract, GIT, kidney and heart. But see, you remember the MERS and SARS, they were affecting mainly the respiratory system. But here, this our COVID-19, it is affecting GI tract also. We have seen quite a lot number of patients, they are having GI symptoms also. So how it enters, I don't want to explain too much in detail. Just you remember that the spike proteins which are there in the viruses, they get attached to ACE2 receptors in the nasal epithelium or any other part of the respiratory tract epithelium, and with the endocytosis they go inside and they multiply inside the cell, and they come out either through exocytosis or because of their outnumber, the cell gets burst, cell dies, and these viruses comes. Once they come out, they go to the further other parts to infect more and more. Means maybe infection might have just gone into the nose or directly into the throat. From there it is going down and getting infected. So what are the diseases it can cause? Roughly, the pathologically you should know. Initially it will cause upper respiratory tract infection, means symptoms can be from nose up to the throat, anywhere. You know, anosmia, loss of sensation of smell, is one of the initial symptoms. And anyone, what we have seen clinically is anyone who is having loss of smell, they may be having corona, but this corona can be mild. It is still in the upper respiratory tract. Then after that, these patients may have a lower respiratory tract symptoms and the signs. Then after LRTI, they can make interstitial pneumonia. Interstitial pneumonia means what? It is also called atypical pneumonia. It is called even the walking pneumonia, where patients will have a dry cough and breathing difficulty, but there is no sputum production. Initially, these viruses, even some of the microorganisms, other things, these things, they cause inflammation in the interstitium rather than the main part of the lung. So because of this irritation only, we are having cough, and most of the infections, they get resolved either through URTI level or LRTI level or atypical pneumonia level. But after this atypical pneumonia, these cells, after getting damaged type 2 epithelial cells, there can be even the collection of these inspissated materials. dead bacteria, secondary bacterial infections, dead viruses, and they can cause even typical pneumonia. After the typical pneumonia, when it happens, then there will be vasodilatation inside the capillaries of the lungs, then a lot of secretion, so many things. At that time, what will happen? Our lungs, for them, they decrease the capacity to take this oxygen into the bloodstream, or from the bloodstream to take out the carbon dioxide, and this stage is called acute respiratory distress syndrome. In this, what is happening? Alveoli have thickened so much so that we are not able to utilize that. In this, you need a specialized treatment and admission. Even see, as I told, ACE2 receptors are there in other parts also, and they can even affect, see, eyes also can be mode of entry. They can affect eye, nose, loss of sensation. I already told. Heart and blood vessels, they cause mainly because of the coagulation phenomena, and kidney damage also because of the coagulation phenomena. And some of the patients, they are having vomiting, diarrhea, and these patients can be super spreaders. We should remember that. The last stage, the sepsis stage, where there is vasodilatation, lot of inflammatory cytokines and so many things, they are coming into our blood, and multi-organ dysfunction is happening. Unless we give support to them, in the sepsis, patient is definitely going to die. So see, I want to tell you roughly, incubation period for coronavirus means corona entered in your body when you first start showing the symptoms. It is 2 to 14 days. It can be either 2 days only or up to 14 days. He may not have any symptoms. Virus may be replicating inside. But I want to tell about the stages. In the stage 1, asymptomatic stage, initially 1 to 2 days of infection. Stage 2, as I said, upper airway and conducting airway response in another few days, like 4 to 5 days. And stage 3, patients will be having already ground glass infiltration in the lungs, hypoxia, and it is getting progressed towards the ARDS. So any of the patients, those who are having any of the symptoms related to that, we should do screening. And while screening, even with the mask, there should be distance more than 1.5 meters. Some patient may have fever or so many other problems because of either malaria, tuberculosis, some other things. We should remember that also. You are not only treating only the COVID, patient may have COVID with other problems also. But you should remember, some of the old people, they may not have any of these typical symptoms. They may just have some lightheadedness, difficulty in breathing, some chest pain, dehydration. This patient, they should show to the doctor urgently and take a treatment. And in children also, who some of the children, they may not able to tell properly about the history, but you can see their breathing is normally fast than before. If the infants, they are not able to feed well, and blue lips or pressure, or they are not able to wake up or unable to drink, all those things. In these things also, you should remember, you should keep in your mind, it can happen in COVID. So who are the people? Those who can have a severe disease, age more than 60 years. Increasing with the age, risk increases. Those who are having hypertension, cardiac diseases, chronic lung diseases, cerebrovascular diseases, even diabetes, immunocompromised diseases. And here I want to tell about a special mention about the smoking. Young people can also be a heavy smokers, and they can also die of severe complications of COVID disease. So this is also one more reminder for quitting smoking. Now see, so far I told only about the pathology. Let us discuss about signs and symptoms. In that, I don't want to read the whole slide. I want to tell mainly, it has been seen that in more than 80% of the people there is a fever, and up to 80% of the people there is a cough. So fever, cough, initial dry cough, later wet cough, this is there always, even in the mild cases. Then patient may develop myalgia or fatigue, and they won't be able to eat, like anorexia, and shortness of breath is seen in 31 to 40% of the cases. And other symptoms like sore throat, nasal congestion, headache, and nausea, vomiting, diarrhea has also been reported. But new loss of smell, it directly points towards COVID-19. If the patient is immunocompromised, they may not have all these typical symptoms that you should remember. Okay, childrens will be having less severe symptoms compared to adults. But let me tell, if someone is having a COVID or they tested positive in the Hamad, and they might have been given some treatment, but they just still want to have one more teleconsultation with us, yeah, definitely we can give them advice. But if you are having a COVID, you are in a home consultation or in a quarantine. If you are having a fever, this fever mainly because of the COVID only, it comes in an average of around 5 days of starting of infection. In this kind of a fever, you need to drink a lot of fluid, and you can take either paracetamol or brufen. There was some message going on in the WhatsApp everywhere telling that you should not take brufen and all, but WHO has clearly said that so far no side effects have been seen till now. Okay, if patients are having a cough, COVID-19 patients are having cough, if it is a dry cough, means patient may be having just because of either URTI irritation or just atypical pneumonia. In these kind of patients, you can give them a cough suppressant, but cough is an important reflex to take out the all respiratory content from the lung to outside. So we should see only if you should use cough suppressants only if patient is having dry irritant cough. And some of the examples of cough suppressants, they contain like the codeine, but here I generally go for dextromethorphan or other cough suppressants. And taking honey is also one of the natural remedy for the cough. As you know, old age people, they will have a less cough reflexes, and they are going to develop more severe forms of pneumonia than the normal people who are having normal cough. And I want to here give a special mention, lot of patients, they're having only initially only the no smell, and for that they come, even some of the patients, they visited me also for this anosmia or loss of smell. For this kind of a patient, if they don't have any other thing, what I have seen is two-thirds of the patients, they recover without any treatment, but one-third of the people, for them this loss of smell becomes a permanent. For them, you need one small home treatment called olfactory training, where you need to sniff 4 types of things every day for 20 seconds, 2 times daily for 3 months: rose, lemon, clove, and eucalyptus. You take them in house and try to smell daily 2 times for 20 seconds for 3 months. Then you can even use international vitamin A or even vitamin A tablets also. Okay, they help in healing the mucosa, and omega 3 tablets also. And if someone is having a breathlessness, what to do? Mild breathlessness, tolerable, and if they don't have any other symptoms, for them you try to be cool and stay in a cool room. You can even open the window for a lot of air and try to sit upright, relax your shoulders, and control breathing techniques like one side positioning or even pursed lip breathing. It means what? In pursed lip breathing, what will happen? You will inhale like the lot of air, then after that breathe out through only pursed lips, means close the lips, open little bit of the lips and breathe out. You can even lean forward with the arms like bracing a chair, that will also help in breathing. So, and one more important thing what I want to tell is, if someone is having a very old age, they are COVID positive, and they are not admitted in the hospitals, for them one simple thing is, I want you to buy one pulse oximeter, keep it with you, keep checking. It is safe method, and there is no harm in that. And you can see how much is the saturation. If saturation goes less than 94, then you can directly go to the hospital to show. Whenever there is So, in the hospital or anywhere, whenever you see the suspected patients or you are going out, always infection control measures. Wear the mask for general people when you are going out, and according to the WHO, right way to wear the mask is, see, the colored part should be outside. Lot of people wearing, the reverse way. No, no, the colored part should be outside. The place where there is strip, it comes near the nose, not the other way around. But for the doctors, see, like I'm wearing N95 plus surgical mask plus goggle and all this proper PPE kit we are wearing because we are examining patient from close by. So how to disinfect? I think most of you know with the alcohol solutions or house cleaners and so many things. I'm not going to tell much about that. In the lab diagnosis, the main thing, we are diagnosing COVID-19 by RT-PCR test. In that, what we do, we take a sample from the nose, nasopharynx, and from the oropharynx, and we send it to the lab. In the lab, they will detect the virus, and if it is positive, this is the only conformity positive. There are so many rapid tests and antibody strips and all, but they are actually generally not used for diagnosis purpose, mainly for epidemiological or screening purpose they are using that. And some other lab parameters, they are increased, and generally we can see even in this thing, if these lab parameters are more, particularly in old age patient, like increased WBC count or increased CRP, D dimers and creatinine, all these things, patient has to be admitted and monitored in the hospital, particularly the old age person. But I want you to tell mainly important thing is, if the area is endemic for the leptospirosis or dengue or malaria, you have to test for that also. Fever may be because of that problem, not because of the COVID. And there is a proof from various studies that dual infections with other respiratory infections can also be found together, like either viral or bacterial or fungal. So the people, whether from the house or the hospital, went to stop isolation. According to the WHO, for symptomatic patients, 10 days after the onset of symptoms, plus patient should not have 3 days without any symptoms. And for asymptomatic patients, once they do the test positive, 10 days is sufficient. And some people, hospital admitted people, those who are having so many other treatments for them, they're telling maximum 20 days. After that, patient will be not infecting with the virus to others. So how to manage a mild COVID? As I said, you may be needing only a simple paracetamol, but I always request all of you to try to be in touch with one of the doctor until your quarantine period is over. If you are admitted in the Hamad or any other hospital, it is okay. If you are not admitted in the Hamad, then book a consultation with us through KIMS Telehealth and talk to us, we'll tell. See, recently I seen one of the patient, he had taken from a pharmacy paracetamol, but he was allergic to paracetamol, and no one were knowing what to do if someone is allergic to paracetamol and if they're having fever. In such cases, you need to talk to a doctor. Sometimes you may not have this COVID, and you may have so many other things like infectious mononucleosis, where you won't be able to take brufen. You should not take brufen, you should talk to the doctors, and we are the one who will decide properly what to take. But generally, if you are not allergic and if everything is there, then there is a proof that either Panadol is safe. If you are having some sore throat, some nasal congestion, all those things, like antihistaminic, like even Zyrtec also you can take it as a cetirizine. And some immune boosting things like exercising, eating healthy food, and good sleep, particularly 8 hours sleep is very much important. And for children, we should know very much important. If some parents are having COVID and you don't know whether children are infected or not, you've not done any checkup, then for infant, main important thing is whether infant is taking feeds or not. If patient is not taking feed and there's grunting or breathing difficulty, then you should show to the doctor. Big children, if they show blue lips or chest pain or pressure, or if they are not able to wake up, then you should seek opinion of a doctor. Symptomatic treatment, everyone says, and everyone, I think most of them know, vitamin C 500 mg tablets for 1 month you have to take, melatonin tablets also, vitamin D also. These are all important for healing. And ranitidine or even famotidine, they have told that it is important in these things, particularly for GI symptoms. Hydrochloroquine, a lot of controversy, but in hydrochloroquine and ivermectin, they are used extensively in India, and I heard even in Hamad also they are giving. But outside, in OPD basis, vitamin C, vitamin D, paracetamol, some antacids, antihistaminics, that is sufficient. If someone is having a pneumonia but they don't have much breathing difficulty, in that cases, or they went to the Hamath, they are having a mild disease, they gave treatment and they sent them back home. That time I advise such kind of a patients, and particularly the old patients, to buy a pulse oximeter. The instrument like this is very easy to use, just you have to put in the finger, battery operated, there is no harm. You can see how much is the oxygen saturation. If you see oxygen saturation less than 95, less than 94, then straight away go to the hospital, get admitted. If the oxygen saturation is more than 95, with the home treatment also, with the antibiotic or even with the telehealth medications, even with the oral tablets, generally you may recover. See, you can see on the x-ray the ground glass opacities, mainly the peripheral distribution you can see, and this is because of the COVID. If someone is having a severe pneumonia, how to tell it is severe pneumonia? You checked it is SpO2 less than 90, and there are so many other emergency signs like no breathing, respiratory distress, or someone has turned completely blue, or shock, or coma. Then straight away call the ambulance 999 and go to the hospital. Even if a pregnant woman also, if she is having breathing difficulties, she should go to the hospital and treat. Now I heard Cuban hospital has been designated for a COVID-19 pregnant patient to treat separately. So in the hospital, I just want to tell, see, generally high flow nasal oxygen is sufficient for, as I said, 85% of the patients they recover with the mild symptoms. 14% patients after admission, generally with the treatment, they recover completely. Only 4 to 5% of the patients they go in for a severe complications, including a death. I am just showing you, see, high flow nasal oxygen in this, the oxygen is attached to this HFNO system and you're breathing normally. Even the prone breathing also is effective, and some physiotherapy also they do. Mechanical ventilation, if they cannot tolerate HFNO system, but all these things, proper PPV they are taking, and of course we are not doing all these things, everything is done in Hamad only. And convalescent plasma therapy taken from the recovered patients, this is also has been tried and with some successes, but more studies yet to be done. And some people, particularly children, they can have severe allergic reactions like a cytokine storm or systemic inflammatory response syndrome. In such kind of things, this IV injections of dexamethasone and tocilizumab has been very phenomenal, and a lot of patients have recovered, even almost going near to the death they have recovered. And as I said, ARDS patients, some patients, around 20% patient, COVID patient may go in for ARDS, and even in that complicated patients also, some people may have even venous thromboembolism, cardiac complications like even heart attack, kidney injury, and multisystem inflammatory syndrome, as I told, SIDS. Generally it is seen in children, and in this children will have fever and organ dysfunctions. So the end of the first part. Now, okay, let us continue about common ENT infections. And one of the most common in anyone's life is common cold or coryza. And in that, it is most commonly because of the viruses. And in that also, most common virus is the rhinovirus, about 70% of the cases. And around 10 to 15% of the cases is it's a human coronavirus. I am not here talking about the COVID-19. Means we had even normal human coronavirus causing common cold, and it is going. Only this animal coronavirus, it has jumped the species and it has come and it is causing so many problems. Other virus which is causing is Coxsackie A, and even Coxsackie B also can cause, but Coxsackie A is the one which makes lesions of throat also, cold also, even sometimes hand, foot, and mouth diseases. And most commonly this is self-limiting. In 7 to 10 days it will go by itself. You should avoid aspirin in common cold, and you can take a paracetamol or even a brufen. So here the dosage of the brufen for the children is 4 to 10 milligram per kg per dose, and you should not use if the child is having stomach pain or bleeding ulcer. And if someone is having heart disease, BP, sugar, any other problems, you take the advice of a doctor before taking these. And syrup Adol or paracetamol syrup is 10 to 15 milligram per kg body weight, and you can even have these suppositories you can put in the rectum down near the toilet place. And another important common condition is allergic rhinitis. In allergic rhinitis, patients will have a lot of sneezing. Patient may tell he will have irritation and even the watering of the eyes and even the nose irritation. And when we examine, you see generally grayish mucosa of the nose. You can see this is not a polyp, this is just a grayish hypertrophic turbinate. Over that mucosa is a gray, it is a allergy. Whereas in irritative rhinitis, or if they are having a bacterial rhinitis, their mucosa is red. You can see this picture. In allergic rhinitis, mainly treatment is the antihistaminics like Aeries. You can even give a Zyrtec, or we give Nasonex nasal spray, tube of BD also, or tube of OD depending upon the condition. And this allergy is mainly because of the exposure to dust, smoke, irritating gases, and even because of the irritation also, patients can have irritative rhinitis. And there is one more condition called a chronic rhinitis, where patients are having nasal discharge or some sort of nose problems always. They are not having a severe, but they are having, particularly you see like this, or like this, or some nose or something. This is because of the chronic rhinitis. That is because there is a postnasal drip, means from the nose the contents are going into the throat and irritating the throat, forcing you to spit it out. It is mainly because of the chronic irritation from the dust, smoke, cigarette smoking, or snuff. And in the chronic rhinitis, nose generally it looks hypertrophied. The nasal mucosa is hypertrophied, and it even reacts to because of the tobacco, or even if you use a lot of nasal drops. See, for example, these Otrivin nasal drops you should not use lot. If you use more, what will happen? You will get a rhinitis medicamentosa, means maximum you can use Otrivin for 3 to 5 days only. If you use more and more, what will happen? Your turbinates are going to become a big, and you may have a symptom relief only for a 10-15 minutes, half an hour like this, but you will have a nose block for a longer duration. So in a chronic rhinitis, simple normal saline nasal sprays you can use. I said Otrivin nasal spray to open your nose, but you should use maximum for 5 days. And there is one more condition called a nasal polyp, where because of the allergy or constant irritation or infection along with the allergy, you will start having a constant nose block. When we examine, we see pale grape-like masses inside your nose. These are called nasal polyps. And you see the first picture, the nasal polyp, after seeing a direct. The second picture you can see deep extent, you can see after doing a nasal endoscope. These kind of a thing, initially you can treat them by giving antihistaminics, nasal sprays, nasal topical steroid spray like Nasonex, or even you can use Avamis. It contains mometazone, and these sprays initially they are very good, and if there is no relief of the symptoms, then you have to go for functional endoscopic sinus surgery to remove these polyps. This is called a FES. Some patient may even have a nasal block along with the headache also. Generally, this is because of the sinusitis. As you know, we are having 4 pairs of sinuses: frontal sinus, ethmoid sinus, maxillary sinus, and sphenoid sinuses. So these sinuses are important mainly for reducing a skull weight, and even for breathing, and even humidifying the air also. So these sinusitis can occur because of either viral, bacterial, or even a fungal causes. I don't want to read whole slide, but you should know, if you are having pus like a nose discharge, nose block plus face pain, it is sinusitis. Initially, let us talk about viral sinusitis. Viral sinusitis, after having episode of a viral cold, you will start having a nose block and a headache, and sometimes even a body ache also. The most common viruses causing viral sinusitis is rhinoviruses, influenza, and parallel influenza viruses. In this, the main treatment is symptomatic decongestants. Even you can take paracetamol and a steam inhalation. Steam inhalation you can do with just hot water like in the picture, or with the specialized machine also. You can get it, keep it, and it is one of the safe natural treatment for viral sinusitis. Of course, you can even use normal saline nasal spray, as well as even Otrivin for not more than 5 days. Whereas in a bacterial sinusitis, it is the one which will go only after treatment with the antibiotics. Most common bacteria causing this sinusitis is strep pneumonia, Haemophilus influenza, and Moraxella catarrhalis. And Moraxella catarrhalis is much more common in children than in adults. Okay, so in this bacterial type of rhinosinusitis, how to confirm it is a bacterial? With a culture and sensitivity, or on the endoscopy, if you see clear mucopus coming out from the sinuses, it is definitely bacterial. If you do culture sensitivity, you may get these organisms. But if patients are there in the hospital setup, organisms may be slightly different. For them, you have to do culture, then only start antibiotic. And the first line of treatment is mainly you should give a treatment for 10 to 14 days. You can give augmentin, azithromycin, and even other tablets also, depending upon the condition of the patients we see. There is one more important thing I want to tell here is most common decongestant and antihistaminic we use Clarinase. Many people they may use. You should not combine them with either fluoroquinolone or clarithromycin. Because in the Clarinase, the pseudoephedrine, it can cause increased heart rate or long QT syndrome or even arrhythmias also. So in this, whenever you are taking this kind of a treatment, for them antihistaminic which is safe is you can use sedative antihistaminic, or even like levocetirizine or cetirizine. And one more treatment, mucosolvan, also to make the thick viscid secretions in the nose and paranasal sinus thin, we use mucosolvan. And if there is a nose block, you can use for 5 days Otrivin to relieve the blockade of sinus ostia as well as the nose. But if patient's sinus is not going for more than 1 month, even with the medical treatment, it is called chronic sinusitis. Chronic sinusitis, it is mainly because of the obstruction of the sinus ostia. You can see in the first picture just pus. If you do the endoscopy, you can see pus coming from the sinus ostias. The x-ray you see down on the left side of the nose, complete maxillary and ethmoid sinus are blocked. After the interpuncture done in the last this picture, you see the sinus getting cleared after the interpuncture completely properly. But nowadays antral puncture are not being done directly, we are doing a face surgery. But there is one more important thing you should remember is about the fungal sinusitis. Fungal sinusitis normally generally mild in all patients, but diabetic patients are the patient those who are taking chronic steroid treatment or cancer treatment. In that there are some special funguses like a mucor and rhizopur. They can go and they have got a capacity to invade into your blood vessels, even into the brain. That kind of a fungal sinusitis you have to recognize properly early, remove it, debride it, do the treatment properly, followed by giving systemic antifungals like amphotericin B. But some patient may have a more than one side of the sinuses involved, and in that case it is called a pansinusitis. Of course, FES is the treatment of choice in most of the chronic sinusitis nowadays. Let us talk about throat infections, common throat infections. So sore throat or acute pharyngitis, where patient may have just throat pain. Most commonly they come to the OPD, and nowadays it has become a more after COVID coming. Patient must to come to me and tell me, please see my throat, maybe I have a COVID. If you see a throat, you will not detect COVID. You will detect whether there is infection of the throat is there or not. Of course, corona can be there in the nose, nasopharynx and the throat, but you can test them only through RT-PCR. But acute pharyngitis, it can be caused both because of the viruses or bacteria, and in that typically you will have a sore throat. Sometimes uvula is congested. You can see in the posterior pharyngeal wall is congested. So if you suspect bacterial infection, then only you should give antibiotics. Otherwise you can tell them to do salt water gargling. They can take a vitamin C tablets or like that. There is one more important is herpetic or gonococcal pharyngitis. This has become a more because it has got a sexual route of transmission, more common nowadays. It had gone before, but now because of the sexual route of transmission, one single dose of ceftriaxone is sufficient to treat this. And there is one more type. Yeah, so see here you can see the ulcers in the soft palate, sometimes even on the uvula. See here you can see ulcers over the uvula and the soft palate. This is called herpangina. And in herpangina the treatment is mainly just you can give painkiller throat sprays, salt water gargling, or even just mouthwash with the chlorhexidine. Sometimes if patients are taking chronic steroid infections, or some people those who are taking pumps for asthma and some other things, they may develop a sore throat because of the candidal infections, where you can see curdy white kinds of precipitates. See in the first picture you can see extensive candidiasis, second picture in puncture like place in a small point like a places. In these cases they need both topical antifungal agent as well as the oral antifungal agent. There is one more condition I want to discuss, and nowadays I'm getting a lot of the patients are having chronic sore throat or some throat irritation or some problem in the throat from more than a month or 2 months or 3 months, and they have gone to many doctors and there is no relief. They tell no, doctor has not given a proper treatment. Nowadays because of this COVID, lot of WhatsApp forwards, they started taking lot of treatments, too much garlic or too much hot water gargling and so much irritation to the throat. It is causing a chronic pharyngitis. It is mainly because of the irritation. You should stop that irritative thing, and this irritation can be either because of the dust or environmental or because of the diet or sometimes even tobacco chewing. Such cases, what to do? Don't do anything. Just you can keep a normal, drink a lot of water, take a vitamin C, or some gargles or throat sprays are sufficient, and it will go by itself. If you irritate more, it will stay. But there is one more types of chronic pharyngitis. It's called chronic hypertrophic or granular pharyngitis, where you will see in the throat reddish nodules. See in this picture, you can see the reddish nodules. These reddish nodules, initially you can try with just betadine spray. If it is not going, betadine spray from more than a week or so, we use same, like this is also like iodine paint. Also we paint the iodine in the posterior pharyngeal wall. Even if that, if it is not there, then we'll do chemical cautery. This we have in our OPD also. With the silver nitrate stick, we'll just touch and burn them, those nodules. After that it will go. Let me talk about tonsillitis. 85% of the tonsillitis is because of the viral infection, but bacterial infections, they can cause even the heart or other problems, particularly group A beta hemolytic streptococcal thing. Because of this sequelae, you should know about the tonsillitis well. Acute catarrhal tonsillitis, I said, it's a part of catarrhal infection. In any viral infection in the nose, throat, your tonsils may become red, but in these cases you don't need any antibiotic treatment. See, there is one more thing I'm telling. Because of the adenovirus 347, patient may have sore throat as well as a red eye or congestion in the eye. If you have a sore throat plus red eye, it is because of the adenovirus. Of course, in this case also, you don't need generally antibiotic unless there is a secondary bacterial infection. And nowadays also these adenovirus is common, and for these things, for the eye, you can use some antibiotic eye drops for secondary bacterial infection. There is one more picture I want to show here. You can see, you can observe, you see here in the soft palate there is a lesion. It is there only on one side. This is because of the herpes zoster. So these herpes zoster blisters, they can have a dermatable distribution. They can be there on either half of the face, or some on the back side, or even in the throat. In this kind of a thing, in this there is a treatment, local acyclovir cream or acyclovir tablet also you can use. Now coming to group A beta hemolytic streptococcus, is more common in 5 to 15-year-old children, and particularly in endemic countries like India and all, they can cause even the heart disease or even the kidney problems. It is generally not seen in less than 3 years of age. So how do you tell it is bacterial only? If patient is having a fever and no cough, plus throat pain, plus neck some swelling, it is because of bacteria only, and you should go to the doctor, take antibiotic treatment, and minimum course in this type of tonsillitis is 10 days. If you take a 10 days treatment, this tonsil also go, and it will not cause any heart problems. So see, there is one more case, infection because of the streptococci, and in this kind of infection sometimes you will see generalized body rash. It's called scarlet uniform rash. And acute tonsillitis, it can be even just in some points or in the pits like a punctate, or it can be even diffuse. Particularly if it is a diffuse or if the membrane is forming, then in this type of cases you should always try to differentiate it with the diphtheria, because in a diphtheria, early diagnosis and treatment is must to save life, otherwise patients can die. Okay, so how to know that this tonsillitis is because of the bacteria? One simple test is culture sensitivity, but it may take 3 days, 2 to 3 days for the result to come. Before that, for that you can even go for rapid antigen test. These rapid antigen tests, they detect the same within 2 to 3 hours they can detect, and nowadays more and more these rapid tests are being used for starting antibiotic therapy. ASLO titer to see how much effect, and particularly if ASLO titer is very much high, patients are prone for heart diseases. If ASLO titer is high, you should take a complete course of antibiotic treatment that is more than 10 days. And most common antibiotic we give in throat infection is amoxicillin clavulanic acid combination, augmentin, 1 gram or 625 mg. Here dosage is 20 to 45 milligram per kg per day. It is divided into 2 times or 3 times daily, depending. The most common side effect is allergy. If someone is having allergy, you should not give. Other small side effects are like J intolerance, rashes, and even the fungal infections. If someone is allergic to augmentin, then you give them Clacid. This is clarithromycin. I'm directly keeping here all these brand names. It's not because of any other things. Only this lecture is intended for both doctors, nurses, for other healthcare workers. You should know what are the brand names commonly prescribed here. So here it is, the dosage is 15 mg per kg per day, and this but this again you should not use with astimazole, terfenadine, or some other. They may cause heart problems. Again, GI side effect is also there. And one more thing which is safe for a pregnancy is azithromycin. It is just 500 mg once daily or 250 mg twice daily, only for 3 days course, 3 to 5 days. 5 days if severe infections, 3 days for mild infections. Commonly used and safe for pregnancy also. And Zinath or cefuroxime Extil, again this is also safe for a pregnant, category B. And we have Zinath 250 tablet, 500 also, Zinath syrup also. If they are not tolerating augmentin, you can use Zinath. The taste is a little bit better. So along with this, in the tonsillitis, you can even use Panadol, Brufen, and Brufen syrup, or throat spray just for clearing it out. BBC sprays like analgesic spray, even nice spray or gargles. All these are like extra treatment. And betadine throat spray is also very much useful, particularly if they are having a lot of discharge or exudates in the throat. And Azadirachta antihistaminic, the patient is having allergy. If streptococcal sore throat along with the red tongue and other things, if there is a scarlet fever because of the streptococci, then we should give a proper treatment, because they may have some other sequelae. There is particularly called Panda syndrome, some psychological behaviors or some typical eye blinking, emotional, this, that, mood swings, anxiety, eye rolling, and so many things. And these things, they generally, after detecting, if you treat a proper, if you give a proper treatment, they completely get cured. Kids, they get completely. One more important point here to mention about diphtheria is one of the killer. Because of the COVID, a lot of people might have not gone to BSCC, or they have not visited our center for vaccination for your kids, for DPT or DT vaccination. You go, if you take a vaccination, you can prevent diphtheria. I have seen in my lifetime, it looks similarly like a tonsil only. After that, patient will have severe throat pain, then they will have cardiac pain also, they can even die. In my lifetime, I have seen 2 patients walking in with the diphtheria and going out only after being dead. So what was the main reason? They came late. When the diphtheria, it started having a problem with the heart, myocarditis, then only they came to our hospital. Once myocarditis sets in, you can't do much, even though in those patients we did even tracheostomy to clear the airways, but patients died ultimately. So vaccine is important. One more important condition here I want to tell is about unilateral tonsil enlargement because of the collection of the pus in the base of the tonsil. It is called peritonsillar abscess or Vinci. In these kind of cases, nowadays, because of the good antibiotic treatment, these are very less. But if pus becomes accumulated too much, we need to remove. But here most important thing is the doctors, we remove only with the needle. Before, the doctors used to do IND by putting a knife over there in the OPD sitting. That is dangerous, particularly if there is some anemia behind, or if you cut the blood vessels, patient can die on table. That is the reason in this kind of peritonsillar abscess, if you are having any doubt, if your doctor, any other healthcare worker, go and show to the ENT doctor only, don't treat yourself. Okay. And one small mention about the thing is, even similarly like a tonsillitis only, they may have some discharge, but this is not a pus, this is only just exudate. It is common in the children because of the Epstein-Barr virus infection. It is called infectious mononucleosis. These people, they may have even the lymph nodes here in the back of the neck. If you do tonsillectomy also, they may have a discharge like this. These kind of patients where you have to avoid amoxicillin and brufen. In these cases, they may even have a spleen problems, liver problems also, but generally they get completely cured after 14 days of symptomatic treatment. And if you have any questions, you can ask me. You can post it in a Facebook, or you can directly do a WhatsApp. And in future days, more and more like these interactive sessions will do. Since it was the first time, I was not able to do with the proper methodology. Hopefully, inshallah, in future we'll try to do better. Thank you.